Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. One of the mysteries that it actually took me a long time to somewhat solve it was when patients would say, "Doc, I'm just telling you, man, I feel worse when I lay down, or when I get up in the morning or in the night, I just feel terrible." Because most of us know, no matter what hurts us or what condition, if you get a headache, real bad headache, I mean, the first thing you do is just lay down. So it was always a mystery to me, like, geez, like, I think the conditions due to cervical instability, well, the pressure on the ligaments is going to be less when a person lays down. So almost everybody I see, the symptoms were better when they lay down. So what is causing somebody to feel worse when they're laying down? And in the research of that, I came up with the Queckenstedt test. So that's what this video is, the Queckenstedt test, which we'll talk about. It's even hard to say, but it's basically that a person could be laying down in the position that they're laying down, that their jugular veins, both of the jugular veins are closed off, and in some situations that it's more open when they're upright. We all know that there's lots of different reasons that ligamentous cervical instability causes problems. And one of them is obstructive fluid flow, because all the fluid from the body into the brain and the brain out of the body goes through the neck. So if there's a breakdown of the neck curve, it could obstruct the internal jugular veins, which will then cause increased pressure in the cerebral spinal fluid, causing stasis or a decrease in the flow of the cerebral spinal fluid, and that can increase brain pressure, or it can increase intracranial pressure. If a person has a symptom, and the symptom could be as simple as head pressure, eye pain, facial pain, neck pain, migraine headache, and if that is caused by a compression of the jugular vein, well, obviously a person could test it. You could do a Queckenstedt test or a bilateral jugular vein compression test. Queckenstedt maneuver, and I'll show you what it is, was devised in 1916 by Dr. Queckenstedt while serving in the U.S. Army. He was just trying to find a non-invasive test to tell if somebody had spinal stenosis or not. And basically, here, this is an article which Izzy put down there. The Queckenstedt test causes CSF pressure to be increased, and that in turn will reduce the peak flow in the aqueduct of the cerebral spinal fluid flow. And this study showed that the flow decreased by 30%. So the point is, if a person wonders if there's a blockage somewhere in the fluid flow of the brain causing, again, head pressure, headache, tinnitus, well, there's lots of different conditions where bilateral jugular vein compression could be the cause. So one way to do it is just a person at home to compress their jugular veins for 30 seconds and just see whether or not they have an increase in symptom. And then basically that if the jugular vein doesn't flush the brain during the night, the brain doesn't repair, refresh, regenerate, detoxify, then basically it's as if the brain toilet, like the neuronal waste products just accumulate in the brain, and you get toxic brain, or you get toxic metabolites accumulate in the brain. And they're finding more and more that memory problems, dementia, psychological conditions, Parkinson's disease, they're all because the brain has all these toxic metabolites. So could it be that the person has bilateral jugular vein compression because of a breakdown of the cervical curve, because of elongated styloids, and unbeknownst to them, the brain just isn't draining well? So this is where the Queckenstedt test, doing it at home, or the jugular vein compression test, could be diagnostic or at least lead a person into getting the proper evaluations. Now, how we do jugular vein studies in the office, we do bilateral compression of the jugular vein to see if it increases the symptoms, but also we do measurements of the jugular veins to see whether they're closed off in certain positions. So a person whose jugular veins are closed off when they're laying down is in a very bad situation, because all that's going to happen is that there's going to be increased brain pressure, and they don't have a method to reduce the brain pressure, because normally laying down on your back is normally what opens up the jugular veins to reduce the brain pressure. So by doing cervical curve correction, therapeutic exercises, laying in a certain position. So I'm one of those people, because I have bilateral styloids, more so on my right than my left, that I have to sleep on my side, in a certain position for me to have clarity of mind and be of my right mind and don't have brain fog. So I'm now going to show you, me doing a Queckenstedt test, bilateral compression of the jugular vein. So we're going to do a Queckenstedt test on me in the upright position, then supine. So we're first going to, with our ultrasonographer extraordinaire, Karina. So let's first look at my jugular vein. So in the upright position, you see it's open a little bit, and then I'm going to bear down. Right, so that's like if you can't have a bowel movement, you got to go. That's what happens to your internal jugular vein. So then I'm going to have you see it, and then just compress both sides though. So the Queckenstedt test, or internal jugular vein test, is where you compress it. So if you could do it for 30 seconds. And then we're just trying to see, do I get any symptoms? Do I get any symptoms? So this was typically used if a person had migraine headaches and you wanted to see, does intracranial hypertension or jugular vein compression give you a migraine? So I would even say right now, I'm feeling a little bit of extra head pressure. I'm not getting a migraine, but that's probably 30 seconds, right?
Right, 4 more seconds.
Oh, 4 more seconds. Man, she's so exact.
There we go.
Okay, so say somebody had trigeminal neuralgia, even if you had back pain, believe it or not, just that 30 seconds, and when they've done scientific studies, when you have jugular vein compression, the increase in intracranial pressure or cerebral spinal pressure is basically immediate. So for instance, if somebody had eye pain and it was because of pressure on the eye nerve or some other nerve that related to the eye, that compression test, if you then got eye pain, then at least you know, geez, part of the pathophysiology is that I'm getting compression of the internal jugular vein, which we normally find in people who have cervical destructure or a breakdown of their cervical curve, and often that's related to ligamentous cervical instability. Now, classically, the Queckenstedt test, or it's also called the Q test because it's a lot of letters, but it was typically done with a person laying down. So there's people, right? There's people that wake up with migraine headaches, or they wake up with a headache. So this would be a really good test to do at home. It just takes a little bit of force, doesn't take a lot of force, and your jugular vein runs pretty much near your carotid artery. So you could feel for your carotid artery, and then the jugular vein is just lateral to the carotid artery. So you could just, and again, it doesn't take a lot of force. And if it increases the symptoms. So in me, it caused me a little bit of increased pressure. So I probably have some work to do still on my cervical curve. So now we'll do the classic Q test. I definitely felt a little bit of increased head pressure. So I have in the last 7, 8 days, I've been writing a lot. So I really have been with my head down more than I should have it. It's hard for me to have perfect posture when I'm writing. It's just like any artist. It's like painting with good posture. You know, a painter might not have the best posture, but if you at home think that you might have a symptom, headache, head pressure, facial pain, it could even be back pain, thoracic pain, and you wonder, is there a neck component? One of the tests you could do at home is just a simple 30-second compression of your internal jugular veins called the IJV compression test or Q test. And if you do have a symptom while you're doing that compression or afterwards, then it suggests that part of the pathophysiology or the cause of the symptom is actually compression of your internal jugular vein.